So a big warm welcome to the Results UK National Conference, Take a Stance and Find Chances for Change. I'm Ruthie Walters, Campaigns Coordinator at Results UK, and we're an advocacy organisation with a vision to ending global poverty. We've just heard from Gina Miller about the importance of campaigning, why we must speak up even if it's not easy. We heard about the UK context specifically, and in this session we're now taking a more global approach. And we hear from campaigners in a number of countries, which I'm really looking forward to. As the title suggests, it is very international, taking a stance on COVID-19 vaccine equity, a global approach. So we'll be hearing from this wonderful panel about what everyone's up to in their own countries and contexts to campaign and push for vaccine equity and other issues related to the COVID-19 pandemic. At the end of the session, it may run into the break, we'll probably show a video from Nestor, who is a Results Mexico member. He couldn't join us today due to the time difference, but yeah, hopefully we'll hear from Nestor at the end. And we may also have another panelist joining, so don't be alarmed if someone else comes up on screen. Just a bit about us quickly before I hand over. At Results UK, we've been able to ramp up our advocacy on the global COVID-19 response this year, since appointing a new COVID-19 officer to work on equitable access to tools such as vaccines, oxygen, PPE and tests, and linking these efforts with the wider work we do on health system strengthening for more sustainable change. Many of our grassroots network took action earlier this year to call on the UK to share excess vaccine doses and to share them urgently with a transparent timeline and priced fairly. Specifically in the UK, following cuts to the official development assistance ODA known as aid budget, we are calling on the government to act on vaccine equity and dose reallocation on top of the ODA budget so that this already smaller budget isn't further cut. We also work in multiple coalitions on various elements of the COVID response, such as vaccine access, intellectual property, and the TRIPS waiver. And we work closely with partner organisations across the Action Partnership. Given this is such an international issue reaching all corners of the globe, it's a delight to be joined by such an international panel today. And before I hand over to the panel, I just have a few housekeeping notes. If you have any issues with tech or the Zoom line, please put a message in the chat and we'll do our best to help you out. You can also access closed captions at the bottom of the screen by turning on the live transcript option. And this session will be recorded. So that's all from me. Thank you very much. I hope you enjoy the session, and it's a pleasure to hand over to Chris, Executive Director of Results Canada, who will be chairing this session.
Thank you so much, Ruthie, and hello, everybody. I can't see you, but I know you're there. I can feel your presence. As Ruthie said, I'm Chris Dendys. I'm the Executive Director of Results Canada. I am so thrilled, after a long affiliation with Results, to be a part of this esteemed panel and also to be with all of you in this grassroots, literally grassroots to global advocacy webinar and session and training opportunity. So we're, as Ruthie eloquently said, we're now going to take it global. And I can't be happier than to be here with these amazing panelists from around the world, these amazing campaigners, these amazing women, as it turns out, from around the world. So before we kind of dig into the discussion and then hear from you in terms of questions, because I know Results volunteers are absolutely not shy, I'd like to give our panelists an opportunity to introduce themselves. So maybe we'll just dig in, and if my friends on the screen can just briefly introduce themselves in terms of name, organization, and also where you are in the world. I'm actually, I should say, I'm in Ottawa, in Canada. It's dark here. It's just after 6 a.m. But maybe over to you, Varsha. Can you introduce yourself, please, and say where you are?
Sure. Thank you, Chris, and thank you, Ruthie, for the welcome. Hi to all of the Results UK volunteers. I'm Varsha Gandikota-Nellutla. I lead the public policy work at Progressive International and co-coordinate something called the Union for Vaccine Internationalism. And I'm currently calling in from Hyderabad in India. It's a pleasure to be joining all of you today.
Fabulous. And Chika?
Hi, my name is Chika Offor. I'm the founder of Vaccine Network for Disease Control, a non-profit. And then we believe that anything that disrupts development is a disease, and everything that supports development is a vaccine. But we started with vaccination because we discovered that vaccine starts everything. You know, when a child is born, you have to vaccinate the child. And then in the country where I am, I'm from Nigeria, we have so many epidemics. Even right now, we have Lassa fever, we have cholera. So let's start with COVID. So you know that vaccination is critical to us. So I'm the founder of this organization. Our head office is in Abuja. So it's lovely to be here. I'm going to have fun here. And by the way, my name is Chika Offor. The last one is not Offer. It's an O at the end. All right. Thank you. Nice to be here.
Got it. Thank you, Chika. And Rachmi.
Hi, thank you, Chris and Ruthie. I'm Rachmi Hertanti. I'm the Director of Indonesia for Global Justice, or IGJ. IGJ is an organization based in Jakarta, Indonesia, who works on the alternative system on globalizations and future agenda, with some of it focuses on the issue of access to medicines, investor status with settlement, and also related to the food sovereignty and citizen rights, especially related to the patent on sex. Yeah, thank you.
Wonderful. Love being here with all you beautiful women and activists. You're beautiful because of your activism. But so let's dig in and have a little bit of a conversation, if it's okay with you. And our volunteers that are on the line have just heard from a significant and powerful campaigner in the UK about campaigning there within that context. And so to get things rolling, recognizing that later we're going to dig into the realities of advocacy in this COVID era, can you share with us a little bit about the context? Just maybe paint a picture about the context in your local environment in your country related to you know, the political realities and other realities related to the context of campaigns work in your country. So actually, Varsha, can we start with you in Hyderabad in India? What's it like there?
Sure. We're doing better than we were a couple of months ago. All of the kind of horrid pictures that I'm sure all of you have witnessed, we were seeing deaths of something like 4,000 a day until very, very recently. And just as we're sort of feeling better about where we are, we're likely going to have a new wave again in some of the major cities. In Mumbai, in Delhi, the cases have been rising again. We're likely going to see that elsewhere. And vaccination is simply not progressing as quickly as it should. But this is true across the world, right? My work, while I'm based in India, is sort of international. And if you look at the kind of where cases have escalated in Vietnam and Indonesia very recently, in South Africa, and as the US and the UK and European Union kind of discuss booster shots, less than 2% of the entire continent of Africa has been vaccinated, right? Less than half of all of India has been vaccinated. And it's just kind of stunning to see the complete disparity and the complete idiocy, truly, that we do see that the virus has only one goal: to make more of itself. It's completely normal for the virus to change over time, and we shouldn't expect these waves to stop. And I certainly, from where I'm sitting, don't expect these waves to stop. And the only real way to stop them would be to stop kind of giving the virus so many opportunities. But, you know, everywhere, India included, kind of private profits have been prioritized over people's lives, and intellectual property protections have been prioritized over people's lives. And we're seeing kind of vaccination just not progressing at the speed that it should be.
Thanks, Varsha. Yes, we've seen the images from India, certainly, and appreciate that sort of perspective. Chika, what about Nigeria? What's going on?
Okay, Nigeria, the largest population in Africa. Yeah, about over 200 million. And as we speak, we've only 5 million doses of vaccines have been administered. So we're looking at maybe 2% of the population so far. Not really because people don't want to get immunized, but because Nigeria has not purchased any vaccine per se. So the vaccines that we had are from the COVAX facility. So right now, we've had maybe 4 million and another 4 million and then another 1 million of different types of the vaccines, from the Moderna to the AstraZeneca and now Johnson & Johnson. You know, so just looking at those numbers speaks that a lot needs to be done. You know, 2% of the population, what are we talking about? And the best way to get coronavirus out of our system is to get vaccinated. Then layer that upon the other epidemics that we have in the country. So the country, many states are torn between the epidemics, like other epidemics. Right now in Nigeria, we have cholera. And cholera seems to be killing people more than COVID, because in 1 day or two, the person is gone, if nothing is done about it. We also have the Lassa fever there, which is another one. And then recently, yellow fever. So imagine all these epidemics standing side by side and facing the poor population of Nigeria. It isn't easy. And then the fact that Nigeria itself has not purchased their own vaccines, and then we are cap in hand waiting for COVAX to give us, vaccines. For me, what I'm really thinking, and on top of that, people, all this information diarrhea all over the place, people say it affects fertility. Young people don't want to, take the vaccine because you're not sure whether if you take the vaccine, you will not procreate in the future. And then so many of these things side by side, that's the reality of what we face in the country. So as advocates, with the hesitancy, we have to keep advocating and advocating, supporting the states to advocate, to sensitize, to mobilize. So while you are doing that, you also have other things. Now we have the vaccine-derived polio virus standing side again with it. And in some communities in Nigeria, we also have that. And then when people hear the word vaccine-derived polio, it's crazy. Then are you saying people should not take, so all these things are there in the country, but there's a solution. The solution is, first and foremost, I believe that the primary solution is for the government themselves to take charge, so the Nigerian government has to take charge. Then secondly, other, like the COVAX facility, international organizations, countries that have too many vaccines should please give out some of those vaccines. You know what I'm saying? And then apart from that, we should have, a coming together, a collabo, of coming together to say, you know what, people, even individuals can start to say, okay, I have $5. Is there a pool? Is there a GoFundMe type of thing? If the world is finding it, difficult to support other countries, because you will support your country first before you support any other country. So if it's difficult, then we should have something of that nature. WHO is discussing something like that, where people can have like a GoFundMe thing, so that people can now start to do that and be able to purchase vaccines in that way. And then the intellectual property, so many things, are on ground, Nigeria, Africa, is even stating now that Africa should take charge of their vaccine production and all that. I hope that happens, but those are not short-term things. And the coronavirus is not waiting for you to decide on all these things. So in my country, people are taking the vaccines, we don't have enough. At the same time, beside it, we have people who are not willing to take it. Beside it, we have other diseases. So the only solution is advocacy, sensitization, and never giving up, because we can't afford to give up, Well,
I can't wait to dig in with you and all the panelists on some of the tactics that we're taking to try to turn the tide. But I do, I do want to just reiterate, Tedros, the DG of the WHO, said just even the other day, and we've been advocating around this in Canada, to insert myself here, but we're talking about boosters here, with 75% of the country vaccinated, not 2%, 75% of the country vaccinated, and still people living in low-income countries are fighting for the leftovers, and that's abysmal. Just to bring it back to these amazing UK advocates who are thinking globally. But thank you for that, both of you. And Rachmi, just your take in terms of Indonesia and what the context is there in which your advocacy is taking place.
Yeah, I think the COVID-19 pandemic in the end gave rise to the complexity of the problems that the people's movement in Indonesia are trying to respond to. So the COVID-19 pandemic outbreak since the beginning of 2020, for us actually has exacerbated the economic, social, and democratic crisis in Indonesia. For example, from the economic context, from our understanding that the pandemic is used as a momentum for the government to smoothen the agenda of corporations and oligarch in Indonesia. For example, where the government has once again imposed policies that strengthen corporate monopoly and extractivism practices in the name of economic growth, because the economic crisis right now. So one of the strong examples where the government passed the omnibus law, I hope you have heard before about the great protest from the people's movement against the omnibus law, because it is considered unconstitutional and really try to facilitate corporate interest in all aspects in the people's life. And the second, in the social context. Well, for us, the state is not present to ensure social problems in communities affected by the COVID-19 pandemic. This is indicated by how the state budget allocations provides more stimulus to industry and business sector rather than the allocation given to social and health incentive. In fact, the lockdown set by the government is not followed by policies that can effectively address emerging social problems, such as mass layoffs faced by most workers, especially in responding to the loss of income for the majority of the informal business sector that really dominates Indonesia economic activity. And even this has an impact on even bigger social problems, such as the widespread of food crisis. There have been several cases of death due to hunger in several red zones areas that have been exposed to COVID-19. In addition, the increase in the poverty rate due to the loss of jobs and income, which also has an impact on the decline in the education participation rate and the increase in the number of domestic violence. So that's quite high, including how the problems in the distribution of aid, like we call it bantuan langsung tunai, carried out by the government through various programs, led to the practice of corruption by the Minister of Social Affairs last year. So it was really terrible. We are in a very crisis. Peoples are really hunger right now, but then the elite still have still doing the corruption practice for their own profits, something like that. And all economic and social problems in our country lead to a fundamental problem, namely the crisis of democracy in Indonesia, actually. With the excuse of rescuing the economic and health crisis in the midst of a pandemic, the government has closed public access to information, including public participation in the policy-making process. So the lockdown itself is a strategy for the state to keep the people from providing direct intervention in state policies. So the preventions of the people to take mobilizations, for example, it will lead to decriminalization of activists. Including digital surveillance is launched by the state for people who openly criticize government policies during the pandemic. In fact, the recent emergence of protests right now through art or mural art, we call it, that voice the critical voices of the people also didn't escape the silence of the state, because there is a criminalization of workers' art, who are doing the mural art, they are arrested by the police, and I think that is also part of the crisis of our democracy in Indonesia right now. I think that's really complex, the situations because of the pandemics.
Thank you all for that, for painting a bit of a picture and bringing us into your worlds to a degree that I think, we read about it in the headlines, but it's much different to hear it from you amazing women who are on the front lines doing this work. And, I'm going to give notice to our incredible volunteers who are just get your questions ready in a few minutes, because I'm going to ask another question of the panelists, and then we're going to come to you. But can you, Rachmi, just let's stay with you for a minute. Then how do you confront all of that kind of, I don't want to say tyranny, but that the oppressive sort of sense of pushing back advocacy in the context in which you work as a campaigner, as somebody that wants to look for hope and solution, that wants to make a difference, given the tremendous challenges. And then Varsha and Chika, I'm going to come to you as well. And I see Pedro's just joining, so we'll hopefully hear from Pedro too. But Rachmi, can you give us some examples of some of the campaigning work that you do? Just a couple of minutes of that.
So actually, we IGJ are involved here in various initiatives of the movement in Indonesia. So not only to criticizing the economic policy in the one side, but we also trying to push the movement initiative, yeah, on the to open more access for health access to our people, because the key during the pandemic right now is how to ensure that all the people have access to health, yeah, and also access to vaccines, medicines, that we think without that we cannot come back to the normal situations. We are thinking that if the health problems will be resolved, yeah, by the governments or by all the what the all stakeholders right now, we can imagine how the social movement itself can be work, yeah, in consolidating. But during the pandemic itself, we also trying to consolidate ourselves, yeah, to push for an open democracy, rejecting the corporate agenda, and most importantly, how we can encourage people's solidarity to face the pandemic together. So, like for example, we also trying to push how the governments will ensure that the access to vaccines itself will encourage the better situations in Indonesia. As you know that we are not only facing about the inequity of vaccine supply, but also the vaccination process in Indonesia. Like from the total target of 208 million people, yeah, we only reached 71 million people for the first shot and 41 million people for the second shot. So we are really far behind actually, but mostly people outside Java and Bali is still left behind by the vaccinations program by the governments. So I think there will be a disparity and inequality process, yeah, between provinces in our country. But as you know that the problems right now actually in the political interest and the strong interest of oligarch in our country, because even we have succeeded, yeah, to ensure that the government to be supporter on the TRIPS waiver, but the problem is not easy, yeah, how to implement this in the future. For example, how actually there are different positions between elites, and how some people of the elites trying to get more advantage, yeah, to taking profits, yeah. For example, in the purchase of vaccines, for example, they try to get more profits from that area. So we have double like double problems. In the one side, people itself have a problem with the health issues, but in the other side, in the political context, you have a problem with the oligarch system. So it's really like difficult situations for the people's movement during this pandemic. But I can imagine that.
Varsha,
So
thank you. There, to think about, there's a question in the chat about, are you personally experiencing pressure from your government? But Varsha, have you, actually, that's a good question for you too. Have you personally experienced any pressure? But what kind of tactics are you using in India to try to motivate, I think, potentially, advocates in the grassroots, in the community to be engaged with this? Or just generally, what kind of tactics are you using to try to contend with all of the maze of challenges associated with COVID and the collateral impacts?
Sure. Yeah. I mean, when I got into this work, it was clear that the institutions that have been empowered to address this apartheid have completely failed to deliver on their promise, right? We could make enough vaccines for the whole world in 1 year. There's a latest report that says all it takes is $23 billion. If there were no intellectual property, say, taking the example of Moderna, we could make enough vaccines for everyone. So in this moment, what we need is for every laboratory, every factory, every scientist, and every healthcare worker to be empowered to kind of produce and deliver more vaccines for everyone everywhere. Instead, what we see is, rich countries kind of upholding patent monopolies. They made a big announcement. People said, look to the G7, they're going to donate, enough vaccines for everyone, right? They made the announcement of 1 billion doses in the summer when they all met. And then it turns out they were just adding up kind of numbers that were pledged already in February and March. And then Boris Johnson comes back to the UK and says, actually, I don't think I want to give all of it right away. Can we spread it out all the way until summer of 2022? So not only is it meager numbers, but they're not even getting to us as people are dying in the different countries, right? And you have other solutions. People said, look to the WHO. They said, let's create a patent pool. Any vaccine that's created, we'll all use it together. The UK opposed that. And we said, fine, can we at least have a temporary suspension on intellectual property protections at the World Trade Organization? Boris Johnson, once again, and the UK government is in complete opposition of this. And then they say, look at COVAX. Here's a solution that's finally going to give vaccines for the, the poorest of the poor countries. And it's supposed to kind of subsidize these vaccines for everyone. Completely failed to deliver on its promises, but it's also let rich countries dip into the doses of these vaccines. Right before we started, I was discussing with my fellow panelists, in I think late June alone, COVAX sent something like 500,000 doses to Britain, more than double the amount that was sent that month to the entire continent of Africa. So these aren't just kind of accidents, right? It's very clear that there's a deliberate strategy. Wherever there's misery, there are super profits, and it's about booster shots and protecting kind of borders and people in certain countries and let everyone else kind of deal with it on their own. So when at Progressive International, what I've been looking at and what we've been looking at is no forum currently exists for government actors, for progressive government actors to coordinate with each other on a solidarity basis. So to abolish the vaccine apartheid, moving from nationalism to internationalism, from kind of a model of charity to solidarity, and really from a model of kind of competition to cooperation. So what we've been doing is organizing what we're calling a Union for Vaccine Internationalism. Earlier in June, governments of Argentina, of Mexico, of Cuba, Bolivia, Venezuela, regional governments of Kisumu County in Kenya, the Kerala government in India, they all kind of came together along with political leaders like Jeremy Corbyn from the UK, Nikki Ashton from Canada, to say, let's have an alternate bloc. We take inspiration from something like the non-aligned movement. Can we have a new international health order that works with each other, not on a charity basis, not waiting around for these kind of donations that seemingly never seem to come to our countries, but can we produce vaccines of our own? And it was kind of incredible, right? What we saw come out of this summit and this union, where commitments were made by countries like Cuba, a small island nation that has vaccine candidates of its own, that said, we pledge to do open licensing. Anyone that's interested in producing our vaccine, we will collaborate with you. And then despite kind of dealing with the economic blockade, from, say, the 6-decade-old economic blockade from the US, they said, we still care about affordable pricing. We will not make astronomical profits off of this. Anyone that wants to produce this can. And we've heard very similar commitments from Mexico, from Argentina, who all say, we pledge our production capacity, we'll produce for each other. We pledge our regulatory capacity, we'll perform tests for countries that don't have that capacity to do so. So it's kind of incredible to see that this exists. And the question for all of us as activists is, how can we kind of strengthen this platform and create this alternate bloc and really wrestle control away from the imperial powers of the world?
Wow, powerful. Thank you very much. We've got about 10 minutes left. I really want to go to Chika, but then Pedro, I see you. Thank you for joining. We'll come to you for some thoughts on the situation in Brazil and campaigning, just maybe a couple of minutes before we try to take some questions from the audience. But Chika, please, can you also, following in those eloquent footsteps of Rachmi and Varsha, share some of the campaigning experience in Nigeria?
Yeah, thank you so much. Varsha said a lot of things, which is good. But the thing is, after you have gotten all the vaccines and then you bring it to the country, people must be ready to accept it. Because it will be like a wasted effort if at the end of the day, we get all these vaccines into the country and then the vaccines are not accepted. So for us, we are advocates, but so we are not activists, because we realize that activism does not help. So, but when you're an advocate, at least you get listened to. You support the government efforts. Whatever it is that they're doing, you help to mobilize. So we did a research with some organizations on vaccine acceptance. And then we discovered that in our research, many people do not want to take the vaccine because they feel that it's going to do certain things. So the first things first is, how do people should even accept the vaccines? The hesitancy first, is very, very critical. so that at least when the vaccines come, people accept them. That's one. So we supported the government in that area. We also discovered that even as the vaccines came in, and with all this information diarrhea going on, people having different kinds of things. It has a chip, it has an iron chip. When you put a spoon, it can do different kinds of, it kills, it does that, it causes infertility. We realized that, okay, it now started affecting the normal routine immunization. Immunization generally just reduced. So now there's this family approach. So we're supporting the government to mobilize, social inclusion, having women, because we work with women a lot in communities, to understand the value of the COVID-19 vaccine and to stop hesitancy. So now we're doing house-to-house mobilization to make it clear that these vaccines are safe, these vaccines do not kill, and we've been lucky in Nigeria because we've not really had any serious AEFI, adverse effect, following the vaccines. So that has kind of helped. But the challenge we're still facing in Nigeria is, after the vaccines have come in, people should accept the vaccines. So that is our own area of strength, creating that environment, making sure that we are transparent as possible. If somebody has any effect out of the vaccine, then we say, okay, if you have a fever, please don't hide it. There's nothing hidden. And then what didn't help also was that the first vaccine that we got was the AstraZeneca vaccine, The next thing, immediately the vaccine just came into the country. Europe just started their own and refused the AstraZeneca. Europe, you are the one that has Oxford AstraZeneca vaccine. You're the one that has given AstraZeneca to the COVAX facility. So the vaccines come to us. The countries in Europe now decide that they're going to reject AstraZeneca. How do you now expect the countries like us who do not make the vaccines to feel? Is there something about the vaccine? Is there something about the vaccines that are made in India that is AstraZeneca that is different from AstraZeneca that is made in other countries? So it starts to give the impression that there's more to it than meets the eye, and that in itself did not help our campaign, And then again, there's this policy going around that if you take the AstraZeneca that is made from the Vaccine Institute of India, then you may not be able to enter some countries. That's again. So I asked myself, are you helping us in Africa? Are you helping us? You say you were giving us vaccines in Africa. Then you make these statements. Is it that you don't want people to take the vaccine? What's going on? So that in itself is a challenge. And then so our work is cut out for us. We are busy telling people to take the vaccine is safe, then we are busy saying, you, the producers. So because of that, African Union is now saying it's time for Africa to take charge of the vaccine processes. And that in itself is ongoing. But we focus more on advocacy, collaborating with the government, pushing to make sure that people accept the vaccines together with other vaccines. Thank you.
Thank you, Chika. That was powerful. It is really interesting to think about sort of the double barrier of just even advocating in terms of behavior change and access to vaccines, which we experience here as well. But Pedro, I see you. We're so happy that you've been able to join us. Pedro Villardi is the coordinator of the Working Group of Intellectual Property of the Brazilian Network for the People's Integration and Project Coordination of the Brazilian AIDS Interdisciplinary Association. That's a mouthful, but to say that he's joining us from Brazil. Pedro, we're running a little bit short of time, but would love to hear a couple of quick thoughts from you, from your vantage point in the world, in keeping with these amazing campaigners, about both context and then some of the tactics that you've employed to try to make big change in Brazil. Welcome.
Thank you. So sorry for this huge delay. I had a shortage here in electricity, so really couldn't enjoy before. It's a pleasure to be here. It was so exciting to hear to my fellow panel members. So in terms of activism here in Brazil, it's been a very difficult situation with the Bolsonaro government, a government that just didn't care and did everything in his power to fight back all the efforts to fight COVID. And So as a group of civil society working with the intellectual property and access to medicines, we try to push very hard in our country to have this kind of mini waiver inside Brazil, hoping that Brazil could inspire other countries to follow the same path. So the first effort was try to pass a law bill saying that monopolies were not allowed in times of a national public health emergency, and it was difficult, we knew, to pass a law such as that. But in the end, that promoted such a huge debate in the society. We could say that we never had such visibility for the access to medicines issue since GTPI, which is the group I coordinate, is working. And in the end, we were able to approve a law bill, number 12 from 2021, which became the law 14200 about compulsory licenses in times of COVID-19. The most important thing about this law bill was a step further in terms of trade secrets. We know that we have a fluid IP system, and that in these times, probably the most important things to deal with is trade secrets, because I mean the patent, they do not disclose everything. It's necessary to reproduce that technology. So we were able to include in this law bill the obligation of the patent holder to share all the needed information to make that reproduction effective, and also the need for the patent holder to share biological material. So that was very important, and that was the exactly part that Bolsonaro vetoed. So Bolsonaro is against the people. Bolsonaro is totally pro-corporations. I totally agree with Rachmi and Varsha to say that we need to think about ways of improving solidarity instead of charity. We don't want to have a model of a response that is based on donations, because that is totally, and voluntarism, because that's all up to the corporations. They can decide when, how, to whom, in what terms. And we are living the things that we're living now, both in Brazil and internationally, is a result of that voluntarism, is a result of relying or in corporations to deliver health, and they do not seek health; they seek profits. And it's an error in itself to rely on corporations, which are the problem. They are not part of the solution; they cause the problem. So we tried in Brazil to make this case, and to make this case through the advancement of a law bill to put people before profits. Unfortunately, Bolsonaro vetoed this huge part of the law bill, but we are still trying to work around it in the Congress. It's a very difficult process, but I think that can inspire other activists in other parts of the world to follow the same path.
Thank you, Pedro. People, not profits, hashtag people's vaccine, all of those pieces certainly resonate even up here in Northern Canada. We really only have a couple of minutes left. We could talk to you guys all day, and I'm sure the resulters on the line would love to hear more, but so is the limitations of this session. I would love, though, before we leave, you're on the line with about, I don't know, 50 or so incredible Results UK volunteers who do commit their hearts and their minds to try to make a difference in the world, to thinking from grassroots to global in solidarity with all of you. And if you were to, I'm going to throw it back to you and say, think of it like a tweet. It has to be short. But do you have any words of wisdom or advice for these folks who are going to go off and not only advocate for COVID and vaccine equity within their own country, but also from the vantage point of a global paradigm? Rachmi, I'll start with you. Just a tweet, if you were to share something with them. What's your words of wisdom?
Well, yeah, it's a tweet. Yeah. Well, I will start with solidarity, I think, because with the solidarity, we can how people's solidarity itself actually the true answer, yeah, from the false solutions that the state gave to us. And from this people's solidarity, in fact, we can start to stop all forms of corporate monopoly agenda. I think that's the main or the priority of the people's solidarity. How we can show that this solidarity is the power of the people itself. I think that's from my side.
Thank you. Chika, a tweet.
The tweet is, don't stop making noise. Advocacy, advocacy, advocacy. Don't stop making noise and saying your piece, what you believe in, because there are many times you be at that point where you feel like stopping. Don't stop, you know. So, and that's what I believe. I believe, don't stop making noise. Keep advocating, advocating, advocating. Don't give up. So that's my own piece.
I'm with you, sisters. Varsha?
Terrible at Twitter, but let me try. What we need is a new international health order led by the Global South. What Results UK advocates can do concretely is to mobilize in support of the waiver proposal at the World Trade Organization. They can push the Boris Johnson government to force AstraZeneca to share its technology. They can push the government to be transparent, both about its purchases of booster shots, but also about the so-called donations that it pledges but doesn't actually give out and how exactly it's dipping into COVAX. So across all of these fronts, I think you have to keep pushing, keep the spotlight on Boris Johnson and his government, and support what essentially is the start of an important process of decolonization of broader global public health.
Powerful. And Pedro, your tweet.
Well, I'm not very good with Twitter, but I'll try. So I think it was, I think it was up to us as activists to fight in these very hard times. So we have to be brave, and we have to know that we are in the right side of the history. 20 years from now, people will ask, how come did we let this happen? And we say, we didn't. We fight back, so we couldn't. So this wouldn't happen. This vaccine apartheid wouldn't happen, and we have the tools to make this stop, and we are fighting to implement those tools. So in 20 years from now, we'll be able to say that we were in the right side of the history. So we have to be brave, and we have to push, keep pushing for the right to health. And I love the decolonization of global health. I totally agree with that.
Solidarity, don't stop making noise. We need a new health order. Be brave, be on the right side of history. Advocacy, advocacy, advocacy. Couldn't have said it better. Thank you so much for your wisdom, for your thoughts, for your passion, for your commitment, for your fight, and for everything that you do. And back over to you, Ruthie.
Massive thank you to Varsha, Rachmi, Chika, Chris, and Pedro who have taken the time to join us today and share such amazing, inspiring thoughts. Have a good rest of the day, everybody.
Thanks, everyone.
Bye-bye.
Thank you. Bye-bye.
Bye-bye. Bye-bye, everyone. Thank you.
Hola, ¿cómo están, amigos de Resultados Inglaterra? Desde México les enviamos un cordial saludo y esperamos que se encuentren bien y que pronto superemos juntos esta crisis del COVID-19. Agradecemos que consideren nuestro punto de vista respecto a cómo vemos en México el escenario global de los países desarrollados en relación a la adquisición de vacunas. Y al respecto, podemos decir lo siguiente. Al inicio de la pandemia, observamos que hubo un proceso de compras anticipadas, es decir, un acaparamiento de vacunas por parte de los gobiernos de los países del G8. Ese hecho fue visto como algo contrario al espíritu de la cooperación internacional y la solidaridad entre países desarrollados y pobres. Nosotros vivimos en un mundo globalizado, no solamente en la cuestión de la economía, sino en el flujo de personas que viajan de un lugar a otro alrededor del mundo. Las nuevas variantes del COVID-19 se diseminan tan rápido como el tráfico aéreo mundial, lo cual nos plantea que el problema es global, no local ni nacional. En el caso de México, como resultados, propusimos al gobierno opciones para resolver el problema de vacunas en dos sentidos. El primero, en el caso nacional, propusimos la reactivación del laboratorio estatal Birmex, que existe en nuestro país desde 1895 y que tiene una gran experiencia produciendo vacunas para México. En esta lógica, pensamos que las empresas privadas que producen vacunas por sí solas no van a alcanzar a satisfacer la creciente demanda de vacunas y requieren el apoyo de los países y las infraestructuras que en materia de vacunas existen en cada uno de ellos. Birmex ayudó a erradicar en México, como laboratorio estatal, la viruela y muchas otras enfermedades más. Además, abastecía la demanda de vacunas en Centro y Sudamérica. Este laboratorio dejó de producir vacunas por presión de las transnacionales médicas a principios del siglo XXI. Digo lo anterior porque una alternativa es la transferencia de tecnología para producir las vacunas, no solamente por medio de las empresas, sino en los países. Y en el caso de México, produce vacunas AstraZeneca y CanSino Biologics precisamente en los laboratorios estatales de Birmex. Y por un lado, pues satisface la demanda nacional y por otro, la intención es también cubrir la demanda regional de vacunas, es decir, en Centroamérica y en Sudamérica. La propuesta que formulamos fue que nuestro país, en el ámbito global, se pronunciara en la Organización de las Naciones Unidas por un acceso equitativo, ¿sí?, de las vacunas contra el COVID-19 en todos los países del mundo, en especial a los más pobres. Y por eso pensamos que la estrategia global debe recuperar ese espíritu de la cooperación internacional entre países. En este momento, de acuerdo a datos de Bloomberg y del gobierno mexicano, en nuestro país se han aplicado 84 millones de dosis, lo que implica que el 66.9% de los mexicanos está vacunado y ocupamos en este momento el lugar 11 a nivel mundial de vacunas. Menciono este hecho porque es necesaria la cooperación internacional, pero también es necesaria la transferencia de tecnología para que puedan producir algunos países vacunas que satisfagan su demanda interna y la de las regiones. Esa sería la propuesta y hasta el momento ha tenido un resultado favorable en México. Eso sería todo por nuestra parte. Agradecemos mucho la invitación a Results Inglaterra y esperamos vernos pronto en la conferencia internacional. Mando un abrazo afectuoso en la distancia. Saludos amigos